Talks webinar. Today, as a guest, we have Ms. Jissa James, and she will be talking on topic managing an eye health program. Before she begins, I would like to give her short introduction. Ms. Jissa is a General Manager of Professional Development at India Vision Institute. I welcome you, Ms. Jissa, on the behalf of aMero Eye Foundation and all our participants.
Thank you, Solo.
So now you can share your screen.
Thank you. Solo, can I start or?
Yeah, ma'am.
Great. Can you see my screen?
It is not visible yet, ma'am.
Okay.
Yeah, we could see now.
Great. Good evening, all of you. Thank you, aMero Eye Foundation, for this great opportunity. While previewing iTalks, I came across several personalities who have been part of the series, and it is truly an honor and a privilege to talk about eye health project management in this webinar series. Thank you, Kapil, and all his team members for taking me through and being with me in the planning stage. Before I get into the intricacies of project management and the hardcore, terminologies, I would like to take one slide to your attention. It's considering the times that we are all in. We are all bound in home or to the work atmospheres, and we always, I think, almost feel quite limited and confiscated to an extent. So I'm hoping this slide is of some relief. Coming to the context, let us imagine that we are planning a road trip or any journey for that matter. While we talk about it, there are several aspects that we will definitely consider before undertaking any journey for that matter. So let's begin with deciding on a destination. Then, while once we have gone through that process, there will be tons of opinions coming in, and finally you zero in on one spot. And to get there, you will need to book your tickets. You'll need to make sure that your visas are approved. You will need to pack your things. You will need to make sure you have enough money, and you will need to make sure that you have medical insurance or travel insurance to make sure that, if at all something happens, you still have a leeway out of it and can manage the whole process. Well, for those of you who just go on an impromptu journey, but even then, when you look at it from an overall perspective, planning makes things work, and it works better with planning. So, on that note, I would like to begin my presentation. Eye health project management is not different from any project management, in my opinion. My broader thinking in terms of project management is that you will have to break it into chunks and then assign each of these chunks to a person who will then take it forward, who will be responsible for each aspect of the project. And you will also need to make sure that all of this is done in a particular timeline. So anything without a who and a time is not going to work out. It's very difficult to manage something like that. So this is a generic perspective. Let's talk about the main aspect of project management, which is the plan. Without plan, nothing works, especially a broader scale project. Now, While I go through the slides, there are the broader structure of my talk is dependent on planning. And while we talk about planning, we'll get into the implementation aspect as well. I'm just giving that as a preempt. So, what is it that the first thing that we should look at when we are thinking about something? So, the first segment is ask the big questions. Now, what are these big questions? Where are we now? The present. So, this can be in terms of an organization, this can be in terms of a project which you want to scale up. This can even be in terms of establishing another entity altogether. So where are you or we or us now? And the second question which we should ask is where would we want to get to? That is the future. Getting back to the first question, the present. We all are very familiar with the term situation analysis, I would imagine. A very realistic picture of where we are now is provided by and only provided by a situation analysis. So some people call it SWOT. There are several terms and terminologies out there. So I'm going to stick on to SWOT. What does a SWOT do? It assesses an organization's or a program's performance in all levels. So again, dividing it into two aspects. One would be the internal factors, and then the second aspect would be the external factors. So in the internal factors, we will be dealing with the strengths, the weaknesses, and in the external factors, I would possibly group it as opportunities or the threats that are out there. And I'm going to detail it a little more in the next slide. Let's talk about the SWOT analysis from an eye health project perspective. So, going back to the strengths, weaknesses, opportunities, and threats, all of these can be assessed or thought about in several categories. So, this could be the manpower, that is the human resource that we have, the materials that we have, the mobility, then the management, and the money. So while we think about these five factors, we are going to think about these five factors in these attributes. One is the capacity, then is the capability, the difficulties, the possibilities, the environment that's out there. So these are the other aspects that we need to think about. So if I may put it in an easier term, the SWOT analysis needs a collective input of every member of an organization. How you structure it is based on what we are trying to find out, but the main aspect is to identify the strength, weakness, opportunities, and threats for the goal that we have. Now, while we do this, we also will have to make sure that we are aspiring for the change that we need to make in our organization or to the project that we are thinking of. So, in conclusion, the SWOT analysis is going to help us understand the opportunities and the threats, highlights the gaps and the issues that are currently existing, so that we can then make a plan to make the change achievable. Without this, it's all like an ocean out there. I have put in some images there. It's more like a huddle race. So you have to figure out a way to make sure that your weaknesses and the threats are overridden by the opportunities and the strengths that you have, or you can bring into the organization or to the project that you're envisaging to do. So the next big question is the future. So how do you know, or how do we talk in terms of future? So to talk in terms of the future, we need to consider where is it that we are going to go. That's a question essentially. So that is the aim. The aim is going to describe where we want to get to. It's a broader statement. And then as a team, as the stakeholders, all of us will have to sit and decide on how are we going to get there. So those are the objectives. And then we know, once we know the objectives, then we have to figure out in what space and time and in how much quantities that we want to get there. So there will be targets, indicators, and obviously nothing happens without money. So we will have to make sure that there is a budget, and we plan the budget in all to implement all aspects of the program the way we would want to. Let's look at an example. Like I said, the aim is a broader statement on what we want to do. So, if I may take this example, the aim is to deliver a course on eye health program management. So, if we consider this as the aim, then what could be the objectives? What could be the steps through which we can get here to the aim? So, I'm going to talk about the objectives. There could be n number of objectives. So let's say the objective one is to develop the course outline. So we need to know what should go into the course. We need to know what all should be there and what all should not be there. And for us to know this, there is a lot of background work that needs to happen. So you need to have a knowledge on what are the courses that are already out there. Is this the gap that the professionals are looking at the moment? So there are several other factors. So those will come in as the background targets or indicators under these objective one. Now the next objective is, which I just outlined, is to develop a marketing plan to reach 500 professionals. It's good that you need to deliver a course. So we have to define whom we are going to deliver this course to. Is this optometrist, or is it ophthalmologist? Is that eye care professionals, or just the managers out there? So you will have to define your category. Then you will have to make sure that the information is reaching them. So it's up to the organization to kind of designate what all are the elements that will help to make the aim achievable. So I've just listed out few just so that you get the perspective. Then pilot 5 programs in the first 6 months. So once you have the course ready, then your next objective could be to make sure that it is implemented, and also see whether there are any changes needed. So you have decided to pilot 5 programs and then take a feedback and then review the course again, like that. So when we talk about all this, all these are collective inputs. Now the objectives may be, if it is not if it is not smart, or if it is not aligned, or if it is not evaluated properly, what happens is at the end of the program, or at the end of what you wanted to achieve, your aim, it is very difficult to make an evaluation plan for it, or to evaluate the project, or to tell the funders that, okay, this is what we achieved. So always make sure that your objective is is smart and can be evaluated and quantified, and with timelines. So this will all come in under several other aspects. So just to stress upon the fact that you need to sort the objectives based on priority, based on feasibility, cost effectiveness, etc. So there are several scoring aspects also out there, which again is dependent on the overall plan and the aim that you are looking at. So this is just to reinforce what I have said so far. So aim describes the broad plan on the change aspired, and the objectives list out clear deliverables which can then be monitored by the respective assigned people. Then indicators and targets describe the progress within these deliverables with anticipated outcomes and timeline. You'll see that I have put in three objectives, and under the first objective there is a target indicator, and then you will see that there is also impact indicator. So I'll come to that in a while. So this could be many, this could not be there for some of it. So it will all depend on the overall plan that we are trying to pull through. So it's again coming back to the objectives, it's extremely important that you try and sort the objectives. So let us say for the course that I was mentioning about before, the same example if we take, there is piloting the 5 programs, there is developing a marketing plan and reaching 500 people, professionals, and there is developing the course. So if you're going to do the third objective, which is piloting the program without developing the course, it doesn't make any sense. So likewise, for any project, you will have to figure out which is the objective that needs the prior or the first attention. And then how do we build it from 1 to 10 if 10 is the last factor or the last objective that you have. And also at the same time, make sure that all of these are feasible and cost effective and within the budget that you are trying to look at. Otherwise, you can have all the plan in the world, but if you don't have the capability, capacity, and the efficiency, and also the money to do implement any of this, it's going to be just a plan. Now, to help with the timelines, the indicators, the targets that I was talking about, very often in a project management scenario, this is the best that we can come up with, a Gantt chart. So a Gantt chart very cleverly lists out all these targets, indicators, and objectives with the overall aim along a timeline. It's so easy. Things become so easy once you have put things in a Gantt chart. So again, the description and how we do it is a little beyond the scope of this talk. So I will leave it there. Like I said, any plan without knowing what is the financial estimate or the budget towards it is quite incomplete. So while we budget our plan or our idea, what is it that we need to list about? So in terms of we all manage in small or bigger ways the budgets at home or at work and in many ways. So let's think simple. And if I put it in that way, we always put in the expenditure, then we always put in the income, and we always put in some overheads. So it's very similar to that in terms of any projects as well. So when we talk about expenditure, we are going to talk about capital, capital cost. So this could be for a building, this could be for the instruments that we would like to purchase, this could be for a software, all that sort of stuff. And then we are going to talk about the operational or the running cost as expenditure. We need people. Then we need to have the money to accommodate all the other costs that will come with people and the time that they are going to provide to the project. In terms of income, when we think about it, some organizations or some projects would already have an in-kind support, as in the organization is going to voluntarily contribute a percentage of of the time or the money, everything can be calculated into a financial figure. And then there would be other parties who are already involved in the project, which will continue supporting a particular project or an organization. So all these are income. So if you have fees, if you have if you have fees, all of that is part of this income. So we need to list out the expenditure and income in relation to the objectives or the targets or indicators that we have already created in the action plan, and then make the budget. So once you come to a total or the conclusive figure, a very important factor is to accommodate overheads. Not all figures that we put through as accurate, although we would like it to be, but it is always a good practice to accommodate about 5 to 10% of contingency. In some cases organizations even up it by 15% or so. But again, if this proposal or your plan is going to go through a funding body or an organization, then you might want to make sure that it sticks to the policies or the conditions those funding organizations are going to put through. Now we have all made this plan. We made sure that we have the objectives aligned, we have the targets, we have the indicators, then we have the budget, all of it. What do we do next? So this is the implementation. We will need to plan out the implementation as well, which will become very easy once you have the action plan made, once you have the Gantt chart made. So essentially, once the planning of the implementation phase is over through the Gantt chart, by listing out the objectives and the activities under it and all that, in the implementation phase as such, there are two aspects that's going to happen. One is we are going to monitor the execution of the project, and second, we are going to evaluate the project. So what are we going to monitor? Let's look into that. So the first aspect would be the progress of implementation, whether it is going with the timeline that we have predicted or it is meeting the targets that we have already put in. Then it should also identify, our monitoring should identify problems and solutions. So the scenario that we are in at the moment is a perfect example. For example, so if I may take up the sample project, we have a vision screening program for a particular area, and we had all this planned to complete it by July 2020, let's say. So if that is there, and then all of a sudden we are in this COVID crisis, and we can't do any community projects, community activities. So we have identified a problem. Now we need to find a solution. The solution might be to write back to the funder saying that owing to this particular scenario, we would need an extension of the timeline that was approved earlier. So while when you monitor, you have to monitor not just for the progress of the project, but also monitor that there are no problems. And if at all there are any problems, we will have to figure out the solutions as well. Again, the next aspect which we will monitor is review the implementation. It so happens very often that we have a good plan and a protocol in place, but we might identify a loophole once it is in the running stage. So at that point of time, we will have to figure out a way to make sure that the implementation runs smoothly. So you might have to, correct the course and then get back to square one again. But then again, this is an output of the monitoring that we are going to do. So when you monitor, like I said before, there are indicators that we can talk about. What are these indicators? So if I group them in three different categories, we are going to monitor the process. So this will happen very, very frequently. So if I go back to the case of developing and delivering that eye health program management course, the process would be, let us say the objective one was to develop the course outline. So if we are going to develop the course, we need to make sure that we have experts on board, who can find out what will suit best into the course. Then we need to hire them. We need to make sure that their time is monitored. We need to make sure that we are getting back something from the hired people. So in terms of the course, so we monitor that particular process. I've quoted some examples here, as you can see. So it could be the income from the processes that we are involved with. It could be the number of activities per month, and also it could be the number of people who are detected with the diseases. These are just few examples that I can think of. We can also think of outcomes, the outcome indicators. So this kind of a monitoring is done a little less frequently. It means usually we will have 6 month outcomes or a yearly outcome. It depends on the project overall, but a few examples to quote would be the number of surgeries done in a month, or the number of surgeries done in 6 months, number of spectacles dispensed, number of professionals trained, etc. So going back to the previous example on the marketing, develop a marketing plan to reach 500 eye health professionals, let's say. So your indicator after that particular time period is going to be how many people did we reach. So you can do this you can do this monitoring in the middle of the marketing strategy, marketing plan. Say that in 3 months you're going to reach 250 people. Did we reach there? So that's an indicator again. Now the impact is a little difficult to assess, but it is always done at the end of a particular project. So this would usually need another survey or a study to make sure how to list out what has been the impact of a particular program. So I'll take two examples here. Um, if we are looking at a refractive error project, and the aim was to reduce the prevalence of refractive error from 7% to 2%, something like that. And post your entire project, what we will be looking at is another study within the same community and see how many people, what is the prevalence now. So that is going to speak about the impact of the project. Again, going back to the previous example on the course and of the eye health program. So in which case the impact we are going to assess among the community on how well they could manage an eye health project later once they completed the course. So this would take time, and this will have to be definitely done after the project ends. So, in other words, if I define how we are going to monitor the plan, we are going to monitor the project's progress. We are going to monitor the scope and quality. We are going to monitor the schedule and the staff, and we are going to monitor the budget. So the next aspect of the implementation phase and also planning the implementation phase is evaluating the project. So evaluating the project is in terms of scalability and impact. Impact, I already mentioned about that before. So scalability could be in terms of how we can repeat the model in another part. If I put an example across, so you have done 500 professionals in the first phase of your course, from the previous example of delivering the eye health program management course. So now you might want to take it to another 500 people, or you might want to take it to another 1,000. So that speaks about scalability. While you evaluate, what is it that we are evaluating? That is very important. So you will have to collect the right information to make sure that you are evaluating it right. Now, and this phase has to be planned in the beginning. It cannot happen at the end of the project. Let's say that you have done this massive project of refractive error screening and providing spectacles. And after implementing the entire project, now we are saying, okay, let's evaluate that. What happens is that many often the indicators or the targets that we have set, all of it is going to collide because we don't know where to collect the information from and how to collect it if we don't plan for it in the beginning. We will have to definitely allocate resources. Evaluation is going to take time and money, and very often, usually the evaluation is not done by the internal parties but by an external unbiased entity. And internal or the stakeholders are usually brought in the evaluation phase for information, for collecting, for gathering the information. And evaluation, while they plan how to evaluate a particular project or an activity, it should also account for changes as well as unexpected outcomes. Unexpected outcomes are always a deviation, but at some point of time, and in some aspects, it could be a positive change as well. So while you screened for refractive error, you found out n number of cases in other, which belong to other category as well. So that's a positive thing. And then if they could be referred to another hospital or your own hospital, that's another change and an unexpected outcome if that was not listed earlier. Following the evaluation, once you come up with a report on how the project went, what was the impact, and all that, what it gives us is a report for further course of action. Where do we go from now once you have implemented the project? So, evaluating the project becomes very, very crucial if you want to make sure that your project was run successfully and it can where it can go from the end point. Well, this was the main aspect of planning as well as implementing a project. But there is one factor that I haven't mentioned so far, which is communicate. So communication becomes an essential and integral part of any activity. Why so? Because keeping the information to yourself as a manager is never going to help. So again, the discretions applied. Which all levels are we trying to see here? We have to communicate vertically, which means if you have a reporting manager, you have to make sure that anything related to the project is being communicated. He knows about it, he or she knows about it. Then horizontally between your colleagues. So if you have manager one dealing with objective one, manager two dealing with objective two, very often these are all interlinked. So once you communicate, you kind of make sure that we are not running in parallel roads. Kind of, we can intersect somewhere externally, because it is important that whoever is funding you, whoever is involved with you as a supporter of the project, they get the right information. This could be in terms of feedbacks from the people who have benefited from the project. This could be in terms of the indicators, the in between project reports. Then this could be in terms of the media coverage that you would have received. This could be even photos of your beneficiaries. So several things like that. So it is important, extremely important, that you communicate several aspects of the project or the program as and when it happens within the distinction of view, vertically, horizontally, and externally. So I have nearly come to the end of my presentation. And this is kind of an image which kind of sinks in with whatever I was trying to say. So you have the bulb at one end and you have the dark point there. So the idea clicks in, and you have to figure out your journey from the idea to making sure that it is a reality. So what are the aspects? Everything is pretty much covered beautifully in this image. So which is why I thought I should use this in as the last bit of presentation. Before I conclude, I want to acknowledge Miro Eye Foundation and the iTalk series again, my colleagues at India Vision Institute, and ex-peers at other organizations that taught me a lot, and my students, my teachers, and a lot of what I covered in this course was from my learnings from the course on global blindness, planning and managing eye care services by London School of Hygiene and Tropical Medicine. It's a beautiful course, and I would recommend it to anyone who's going to look at it. And yes, all those beautiful images were from the Google clip arts and several other sources. So I acknowledge all of them for the talk. And once again, thanks so much for the opportunity, and I'll be happy to take any questions if at all it's there.
Okay, thank you so much, Jissa ma'am, for such a wonderful session. Well, now it's time for the discussion session to begin. Are you ready to take the questions, ma'am?
Absolutely, yes.
Okay, our first question goes as how much long time Gantt chart can be made?
Can you repeat that question again?
Okay, how much long time Gantt chart can be made? The time duration for the Gantt chart to be made.
See, it will purely depend on the course of the project that you are trying to do. So, if your aim is to screen 10,000 children in 5 years' time, so your Gantt chart is going to reflect that 5 years, starting from the planning stage to the implementing stage to the evaluation stage, and further the reporting stage. So the Gantt chart is kind of a all-inclusive chart about that whole project. So if it is for 5 years, it's going to be for 5 years, 2 years, 2 years. I hope I answered the question.
Okay, moving further, how to conduct a micro health project?
Micro health project, is that right?
Yeah,
Okay, so you will have to tell me the definition of micro here, but any project, big or small, in my opinion, is to make sure that you plan it correctly. So even if it is for 10 people or it is for 10,000, the planning stage has to sink in quite well. Um, and it will have to go through all the steps that I listed before in the presentation.
okay. Our next question is what are the most common biasing factors for the project and how can we recognize and handle it?
That's a very interesting question. Very often, our objectives, let's say, our objectives are based on, if I may put it that way, are based on the assumptions. Let us say that we are developing this course on the project management, like I was quoting before. And if we assume that the eye health professionals who are in that area or within the target space that you're looking at is does not do not have enough training in managing a project. If that is an assumption, then that is a bias. But at the same time, if that is based on the situation analysis and the studies that you have conducted, the literature reviews that you have conducted, then it becomes solid evidence. So this bias comes in when you bring in your own opinions or your own experiences. This could be a personal one, this could be collective, but at the same time, without the backing of evidence, then it is a bias. I hope I answered the question. And
Thank you
sorry, the
so much,
second part
Jisha
of the
ma'am, for
question was, how do
sharing.
we
Yeah.
overcome it? Yes, so if you talk about overcoming the bias, the only way to do that is by evidence, and also making sure that you consult with external parties at the same time, so that you get a different perspective overall. And this I'm talking in terms of micro, macro, at any level of projects. And at the same time, another important aspect that I would like to mention is that any plan that you make should be fitting in within the universal plan. In the sense, you have a small cataract screening project. Now, that is particularly located to a village. Now, if that project is part of a broader district plan, it makes sense so that it can sync into a national plan. So, you also need to define your project as to where does it fit in. It has to fit in somewhere, and you have to identify where is that niche.
Okay, ma'am, I have a one query. So sometimes it make me so difficult to go through the population pyramid chart. So do you recommend any easy way to do the population pyramid chart if you have any experience?
Population, I didn't.
Pyramid chart.
Okay,
Population.
more like a
Yeah, ma'am.
rapid assessment survey you're talking about.
Yeah, ma'am.
Okay, so one way to go about with my experience and opinion would be to take a sample size, and then extrapolate that data within that particular population. So that could be one way out, and another option could be to look at the existing evidence that's already there. So these two aspects, when you kind of relate with each other, it will give some sense on what you're going to look at.
Okay, thank you so much, ma'am. I guess we have one more question.
So
Optometry
may,
in
may I read the
India.
question for may I read the question slowly because it should be a little bit twisted question actually. So why micro health this presentation specifically need for the optometrist based on the India? Yeah.
By this presentation, I'm sorry, I didn't get the question.
Yes, ma'am. I guess this question is like why the this project any type of health project is needed for the optometrist. Why they should be go for this topic.
Okay, good question again. See, like I said, a lot of what we do in our daily lives or whether in the work environment is purely dependent on the experiences that we already have accumulated within the professional life, and also based on the studies that we have undertaken to be in that space. So this project management or the so-called planning an eye health project is going to help us to have a broader structure already in place for any idea that we want to implement. So let it be opening an eye clinic, let it be implementing a screening program, let it be developing an online course altogether. So whatever it might be, it is it is it is going to give us that perspective on what all are the elements that we should look at when we are thinking of an idea and of implementing it. So in that sense, that's where this particular talk, as well as several other courses that are out there, is going to help an optometrist.
Okay, thank you so much, ma'am. I guess we have answered almost all the queries till now. and hope we all could implement your invaluable insights on our practical life too.
Um,
It's your
Thanks so much for the opportunity again, and I'm hoping that we get to interact more and talk, especially on a topic that's so close to my heart.
yeah. I'd like to express my immense gratitude towards our presenter, Ms. Jissa, for sharing her wonderful insights, to all the attendees for coming up with their queries. Also, I would like to thank all the direct and indirect helping hands for the iTalks program. Request our presenter, Jissa ma'am, to share her few words to our program.
Thanks so much once again, couple and team, and my all the best for the initiative to go through.